right, so my name is Hajar Sabir. I am a recent grad of Cornell University. So looking at the crowd here, I understand that I'm amongst the outlier of the community, but that is one reason why I'm here today, and I made it a point to be here today. Full transparency, I'm still on the clock 9 to 5, but carved out some of my time on my schedule to be here today because that's how important this topic is to me. So I was a information science major in college, almost finished my business minor, and I proceeded to complete my master's up until one class at Cornell University. I'm a first-generation immigrant. Both my parents were born and raised in Morocco, came here to the United States, started from the ground up. Nothing. My dad looked at me in the face and told me he was willing to scrub a toilet bowl with a toothbrush for money. So when I speak about my perspective today, I want you guys to know that I come from a very different background, a very diverse background, and a background of struggle. But vulnerability is the glue of all relationships, and that's what I want you to sit here and let marinate today.
Hi, I'm William Mitchell. I was just up a few minutes ago. I'm grateful to be here today. I am in healthcare in the sense I help people with their health, but I'm really not a traditional medical practitioner. I'm really in what would be complementary alternative medicine. And actually, when I was at SIU School of Medicine, adjunct faculty, was really in the CAM, complementary alternative medicine panel that I would work. And so that's really what I bring to it. I wish we did have a medical doctor or somebody like that up here with us, but that's my background. I'm in Springfield, Illinois, and delighted to be with you.
I'm so glad we have you here today, actually, because this is going to be interesting. It's going to be from a doctor's patient's perspective. Now, a little bit of background about me is that I've actually spent 165 days in the psych ward. So I'd love to hear your perspective on this discussion from a patient-doctor perspective. And this is something really special because I actually just got out of the hospital. And I'm making it determined that I will help people diagnosed with bipolar disorder, ADHD, ADD, mental health disorders. I understand that we are the face of the new generation, and I'm taking that into accountability, and I'm moving forward with that, understanding that. And I want everyone in this room, and these are the go-getters. These are the people in this room right now. I don't care how many people in this room right now. You guys are the go-getters. All I need is 5 people to start. Now, if you guys take this and run with it and we hold hands, we could really start that ripple effect. Now, make your money's worth. That's what I'm saying here. Let's see what we can get out of today and let's innovate, because that's my specialty, is innovation. So innovation meets doctor. So I would like you to kick this off, and then I'll run and trail after you.
Well, I think our topic's talking about the future, and when I saw the topic, I thought, well, what contribution could I make to this discussion? And I thought I'd talk about the fact that it's going to be an increasingly diverse medical field in the future, because not only in the United States but all around the world, complementary alternative medicine is becoming more and more a part of what's happening. For example, some places, the World Health Organization, they add a T to CAM. It's TCAM, which stands for traditional, complementary, and it's integrated medicine in their case. But what we call CAM in the United States, complementary alternative medicine. But no matter where you land in the debate on the efficacy of alternative medicine, there's no denying the increasing popularity of complementary alternative medicine, especially in the United States, but really all around the world. In 2019, the projection was that globally, the complementary alternative market was $69.2 billion. That's a lot of money. That's a lot of money. And the fact is, a United States government survey showed that adults over 18, 36% of people 18 and older are using some form of CAM, complementary alternative medicine. Now, I'm also a minister, and that's my original training. If you add prayer to that, the number would go up significantly higher, be even higher. So that's not even counting people just praying for healing. But it's most often in the United States used for like back pain, neck pain, joint pain, anxiety, depression. And so you've got things like acupuncture, you've got botanical medicines, you've got mind and body healing, and that's where I really come in. Now, we all know about yoga, meditation, energy healing, chakra, but I do hypnotherapy, and then there's also things like magnetic intervention. Really, the list is huge. It's huge. And what's happened is healthcare insurance has actually started covering some of these, like acupuncture. chiropractic. In 2020, Medicare actually started covering acupuncture. So it's really come of age. So you want to talk about that?
Yeah, I think I'd piggyback off of that and hone in specifically to the mental health sector. And what comprises of the mental health sector? If you can think of two professions, what would you think of? Throw something out there in the audience. What is one profession out there that's in the mental health sector? Psychiatric, therapist, psychiatrist, psychologist, right? Those are the two right off the bat. So those are the two I can personally speak on from a primary experience, and that's what I'm going to speak on. I'm going to hone in on speaking on things that are primary experiences because I went through it, so I can speak about it. I also, complemented with that, have a 4-year degree in medicine that I studied in a vocational school at County Prep High School. On top of that, 2 years at Cornell University, I was a biological science major on the pre-med track. So I've taken my physiology classes. I've taken all my classes. I've had one except 2 classes that I didn't graduate with for pre-med track. So when I speak, I want you to take me seriously. But when I entered the psych ward, it was a whole different world. Now, when I think of trends, challenges, and opportunities, I think of back to my psych ward experience for 165 days. The day I graduated college, Cornell University, an Ivy League institution, my parents got a divorce, which sent me into a spiral. Sent me into a spiral that this whole year, damn near this whole year, I've spent in a hospital. This whole entire year in a psych ward. And I'm going to get a little bit uncomfortable here, so I'm going to ask you guys to be comfortable with being uncomfortable, but vulnerability is the glue of all relationships. So I want you to understand that I'm sharing my story. I'm giving you all a piece of me for being here today. But when I was in the hospital, after making a terrible, terrible mistake and a bad encounter with a sergeant, I was admitted under the 501c3 law, which means my background is fine. Like, if you search me up on Google, you won't find me on Google. I won't get in trouble for what I did. But they'll send you into a psych ward, and they'll make sure they reprimand you. They'll make sure. And they'll make sure that they'll keep you into the system. How do they do that, you say? Well, within my first 2 minutes of being there, I was diagnosed with bipolar disorder. Now, I've never heard this word before in my life. I've heard of bipolar disorder as a diagnosis, but I've never heard it pertaining to my diagnosis. So when the doctor looked me in the eyes 2 minutes after me telling her what had happened with the sergeant, a little bit of background story, I got pulled over, and he said I was going one speed. I said I was going another. He threw the ticket into my car. I got agitated. I got out the car, and I did some things I shouldn't have done. I yelled. I screamed. I was manic. My parents just got a divorce. That's not an excuse. I take accountability. But the following events that happened after that was not an excuse. So I served 165 days in a mental institution because of one doctor's ignorance. Because of one doctor's ignorance. You have a question? Yes. They don't. They don't. Yep. Yep, they don't know how to do it. Why? Because they think it doesn't exist. Because all these other cultures put so much backlash. But when you are in a manic state, you don't even know you're manic. So you don't even believe it yourself. And that is the knee kicker for me, is that I didn't even know I was manic. I didn't even know I was manic. And here is this doctor not even telling me the definition of bipolar disorder, not even telling me what I have diagnosed, not even telling me anything, telling me, yeah, you're going to be in here for a while. You have bipolar disorder. I just told you my story. I'm expecting empathy, some care. I'm expecting you to say, sorry, your parents got a divorce, none of that. Yeah, you're going to be on Zyprexa. You're going to be on, what was that one that started with an A? Ativan. You're going to be on clonazepam. You're going to be on antipsychotics, and you're going to be on 2 monthly shots. Okay? You're the doctor. I'm the student. You got it, right? Little did I know that that sent me even more manic, because then I went tunnel visioning. Oh, there's something wrong with me. I never knew I had bipolar disorder. I went undiagnosed. How did I get through Cornell? How did I get through Cornell University, both undergrad and master's, without knowing I had bipolar disorder. Without any medication, without no Adderall, without no Ativan, without no clonazepam, without any of these medications. How did I get through Cornell? So you're going to sit here and tell me, based off of one mistake, you're going to diagnose me with bipolar disorder for the rest of my life? I refuse to take that as an answer. Because I have 6 years under my belt studying the same thing you studied. And when I told her I went to Cornell, she said, this is why I don't like Cornell. Because all their students are depressed, and they have suicidal thoughts, and they don't do nothing about it. But what are you doing about it, Dr. Marshall? Go for it. I would love for you to ask for a question.
Yes. Well, hypnotism has been around many, many years. As a matter of fact, many people would argue, and I would believe convincingly, it's really the foundation of what we now know as psychotherapy, because many of the things we do in psychotherapy really root their way back into hypnosis. Freud, for example, did hypnosis before he ever started his psychoanalytic method. So hypnosis has been around a long time, but hypnosis has been used in many different ways for many different things, and some very appropriately, and of course, as you'd imagine, some not as appropriately. But what I do is primarily, I sort of specialize in habit control, which may not seem like a big deal because it's not as dramatic as something like, and I know a little bit about bipolar, it's not as dramatic as something like that, but what happens is all the time, I have lots of clients who come to me and they need surgery, but the doctor won't do surgery because if you're a smoker, it does inhibit, the circulation and thus the healing to those parts of the body, whether it be the lower back, whether it be your knee, whatever part of the body it is. And so I help them stop smoking, and they have to get the nicotine out of their system before the surgeon will actually do the surgery. And this is pretty much standard of care across the board now. When it comes to weight reduction, I've been doing weight loss from the very beginning, started in 1997. And of course, there's some wonderful new things out there. You've got Ozempic, of course, you have the bariatric. But even with Ozempic and bariatric, you still have to change your behavior. And if you don't change the behavior, you're going to gain it back sooner or later. And so we help people make these behavioral changes. You're saying, well, how can hypnosis do that? Well, I should bring down my laptop, put a video. If you go to my website for my clinic, which is hypnoprogram.com, wonderful little video if you'll pull up the page on Stop Smoking, and it'll make you start laughing because she's saying, oh, I was sure I wasn't hypnotized, but she'd come back for her next session, so I got the video camera out and we videotaped it because she said she got home and she did manage somehow to get the cigarette lit, but then she started doing this. She couldn't get it to her mouth. So then she took her hand, thought, well, I'll make my hand go to my, and she did this and her head started going back, and then she thought, well, I'll take my head to the cigarette, and it went down. And that's actually just a simple little technique that can be done if they're deep enough in hypnosis. And of course, she quit smoking. And so that's just an example. You can do some amazing things with hypnosis, and people like that. I have one talk I give in hypnosis circles. Your clients want the wow, the magic, the hypnotic phenomenon. And there's a whole list of hypnotic phenomenon that are just amazing. Just today, I got an incredible text from one of my students who consulted with me just yesterday, and it was about a new client. And if I may, I'll read it to you. This is a brand new student. She was certified in November of last year, just November, and she's in St. Louis. And here it goes. I gotta get the right one. Yeah, she had told me this woman had a very difficult situation, and she's 80 years old, very sensitive to meds, anesthesia meds. She had knee surgery in 2015, came out of it with a stutter and panting. Lasted 2 years until she had a hip replacement 2017, then it went away. Recently went to physical therapy for knee and stutter. The stutter and the panic is back. The panting is back. Any suggestions? Of course, I gave a couple little small suggestions. So, and I make the point with all my students, a good intervention always starts with a good interview, and that's what I kind of hear you complaining about the doctor. Didn't sound like the interview was maybe as sympathetic as you would have preferred. But anyway, so she just sent me this text, and it reads, wildest session. She came in barely able to walk, extreme stuttering and panting, and sensing a horrible smell making her sick and nauseated. She didn't think trauma had anything to do with it. Could barely get her to calm down in the chair. Tried relaxation techniques, didn't help. Releasing emotions, she didn't think she had anything to release. Regressing to when she could function, turning dials down. Tried it all, and not much was helping or changing. Then she thought she was going to be sick from the smell she was smelling and realized she was smelling the blood from her husband when he was shot 35 years ago. I guided her through that, had her give wisdom and love to herself at that age, brought her back, and the stutter, the panting, and the smell all were gone. She was shocked to realize it's the trauma, the emotions causing it, but relieved to finally understand what was going on. She was laughing as she left, a completely different person than when she walked in, and they said, I did recommend that she start to see a therapist on a regular basis to deal with any of the aftermath of all that. But in hypnosis, it really can speed up the whole process. And it's just amazing. Matter of fact, the code in psychotherapy often, when you're using hypnosis, is they often call it brief therapy. And the reason they call it brief therapy is hypnosis just speeds up the process tremendously. It just really speeds it up. So this is just an example. So I don't know if that answered your question, but actually one thing I would say, people, if you do actually have bipolar disorder, whether it be bipolar 1 or bipolar 2, people with bipolar love hypnosis. My own mother was bipolar, and she just loved hypnosis. And eventually, she let me hypnotize her, and she quit smoking, which she needed to do. But another question over there.
Holistic health, or maybe tuning into I'm so sorry, tuning into your body, maybe sleep, eating, your nutrition. Are you thinking that more things like that are going to take a trend upwards, and not that they're going to take over traditional medicine, but maybe they can assist better than what we currently have?
Yeah, I think that's an amazing question, and I appreciate your answer. But where was hypnosis in the psych ward when I needed it for 165 days? Where was that?
Is your question, ma'am? Oh, I'm sorry. 5 minutes? Oh, wow, I can't believe it.
So
I was afraid just the two of us, we wouldn't have anything to talk about.
Hypnosis wasn't in the psych ward with me. Holistic treatment wasn't even in the psych ward with me. Simple book as a Quran wasn't in the psych ward with me. I was forced to read the Bible, which helped and then I realized I believe in the scriptures, the Torah, the Bible. They all kind of reiterate the same message. And then I realized, okay, so I believe in one God. And then full transparency, I believed in God, and I was like, God is all I have, and God is all I need. So I walked out of bipolar disorder. I'm on 0 medications now. But holistic treatment wasn't an option for me in the psych ward. Psychotherapy wasn't an option for me in the psych ward. So when we address exploring the future of healthcare trends and challenges, this is the opportunity. Now, what are we going to do about it? Here's the gap. Today, I presented to you the gap. But as a 22-year-old that just turned 23 2 days ago, I don't really have all the answers to that question. But what am I doing to try to help? I'm putting out a book that it's going to be called Raw. It's going to be very candid. It's going to be comfortable being uncomfortable. But I went through it, so I can speak to it. But all of these ideas you guys are fleshing out are so great, and I'm so open to trying them. But where were they when I needed them those 165 days? They were nowhere to be found. The doctor was nowhere to be found. She showed up Monday to Friday for 2 minutes and wouldn't talk to me after my 2 minutes ended. So when we address opportunities, here's the opportunity. You don't have to look far to innovate. You don't have to look far to be the next billionaire. Put Big Pharma out, because they pumped medications into me, 6 medications. I was on clonazepam, Ativan. I was on antipsychotics. I was on Zyprexa. I was on 2 shots a month. And now I'm on 0. But that's after that they did treatment over objection for me. That's after they took me to court and forced me to take those meds and forced me to go down the Big Pharma route. So what I'm asking for you all is, please be the face of that change. Be the face of the new generation, because that's what I'm trying to be.
just compassionate care is very important in our field as being clinicians. I've been working in the field for almost 24 years, but I work with autism and special needs, and I work with comorbidity a lot. So for me, what I've seen is that we have to be very compassionate with the kids and the older people that we work with. I also do think that we should be looking into other options and not the big pharma for, and we also should, and whatever we do, it should be client-centered. I just think that's going to make a lot of improvement with our clients. And the psychological well-being of our clients is very important too. They have to be satisfied, and I think that would make a change.
100%.
So I agree with what you're saying, but there are a lot of other people who are going through the same stuff that you're going through. So I think your book will help them.
Thank you so
Thank
much.
you.
That's so helpful. I
I'd-
appreciate it.
I'd like to say just one last thing. One, obviously, all of us in the room feel for you, and we're very sorry you had to go through that. What I would like to say about my practice is, while traditional medicine is perfectly it's not perfect in any way at all, and people that are in that know it. There's a lot of places we still try and fall short. My practice, I work very closely with the medical community, and I receive a lot of medical referrals to work with people, and so I like to see it more as complementary, what I do, as opposed to alternative and complementary alternative medicine. But I work with the doctors, and I always tell people when they come to my office, I said, now, I'm like those TV commercials about medications you'll see. I might say, ask your doctor about, but I'm never prescribing. I'm never trying to take the place of the doctor. But just like in any profession, I'm really sorry you had that experience. Like in any profession, there are some times where people get it wrong. And maybe in your case, obviously, they probably got it wrong. Are we out of time there? Thank you guys for your attention. I really appreciate it. God bless you.
Thank you, everyone.